lot is being said about how the second wave of the coronavirus had ravaged through the country of India. However, when we saw the grim statistics about the rising number of new cases and deaths, along with detailed visuals of the struggling health systems, what was often being missed is the grim and often difficult road to recovery that many of those patients would have faced. Some recover more easily than others, and several face quite severe complications on the road to recovery. One such complication is called mucormycosis, also known as the black fungus. But what is the black fungus and why is it haunting people who are recovering from COVID-19?
Mucormycosis is a serious though rare fungal infection caused by a group of molds called Mucormycetes, hence the name mucormycosis. It most commonly affects the sinuses and the lungs if a person inhales the spores of the fungus from the air.
Its symptoms range from one-sided facial swelling, headache, nasal or sinus congestion, black lesions on nasal bridge or upper inside of mouth that quickly become more severe, fever, cough, chest pain, and shortness of breath. Phew, that is a mouthful, wasn't it? But now that I've said all that, why is it relevant in the context of COVID-19?
Well, it has a little bit to do with how COVID-19 is treated and a little bit to do with the patient themselves.
The mold which causes mucormycosis is present naturally in the environment. The disease only affects those whose ability to fight environmental pathogens is suppressed.
In the case of COVID-19, several steroidal medications can be used to combat inflammation and damage in the lungs if the body's immune system goes into overdrive. However, these steroidal medications also often have the unwanted side effect of reducing immunity and pushing up blood sugar levels in both diabetic and non-diabetic patients.
It is believed that these cases of mucormycosis could have been triggered by this fallen immunity. The complications of this disease can often be quite severe. While it can be treated using antifungal medications such as amphotericin B, it can sometimes eventually require surgery to remove dead and infected tissue.
Mucormycosis can lead to the loss of the upper jaw and sometimes even the eye.
What predisposes patients is uncontrolled diabetes mellitus, immunosuppression with steroids, prolonged ICU stays, and comorbidities. Hence, doctors recommend that it is of utmost importance to control diabetes, reduce steroid use, and discontinue immunomodulating drugs. Though usually extremely rare, with more and more cases being reported across India, several states had in May classified the disease as an epidemic, which added further strain to a healthcare system already stretched by the second wave of the coronavirus. Hence, it is of utmost importance that we keep ourselves in good health and protect ourselves from COVID-19. Thanks for watching and stay safe.